Well, good afternoon. I'm here with Dr. Ezike to provide an update on the current state of COVID-19 in Illinois. More than 20 million COVID-19 vaccines have now been administered to Illinois residents. That's the highest number and the highest percentage of residents who have gotten a shot among all Midwestern states. On top of that, nearly 80% of our eligible seniors have received a booster shot, along with nearly 55% of all of our eligible residents. And we are pushing that number higher every day. In fact, right now we are administering an average of 47,000 shots, first, second, and booster shots every day. The Omicron surge has tested and proven once again that vaccines and masks are our best tools to keep most people safe from each variant of COVID-19. Nevertheless, Omicron's high transmission rate caused more COVID hospitalizations than ever before, the vast majority unvaccinated. Our hospital systems and healthcare workers have battled to treat and to save not just COVID-19 patients, but every patient who walks through their doors. They've been working harder than ever before, and I hope that everyone listening will take a moment to express your gratitude to each of them. Over the last 2 years, I've said over and over that you don't know when a surge has reached its peak until you're on the other side of it. Today is our 7th day since we saw peak hospitalizations of 7,380 reported on January 13th. That's 1,145 more than the previous pandemic peak on November 21st. Since then, our single-day number of COVID patients in the hospital has fallen by over 870 patients. That's a decline of 11.8%. Over the same period, ICU and ventilator usage has started to decline, a welcome change after precipitous increases over the prior 7 weeks. I want to be clear, I am cautiously optimistic about this decline. But there are an awful lot of people still battling for their lives in hospitals across Illinois. With our ICU capacity at around 10% and 6,500 COVID patients overall in our hospitals, we're continuing to provide as much relief as possible to all of our patients, to our healthcare workers, and to our hospitals. We have lost so many people in recent weeks. Since the beginning of January alone, over 1,500 of our state's residents died from the virus. Despite the recent indications of fewer new infections and fewer new hospital admissions ahead, it breaks my heart to know that in the coming weeks, hundreds more may die among the thousands who are already seriously ill from COVID. Again, the vast majority of those are among the unvaccinated. That said, our declining hospitalizations rates are a hopeful sign that vaccinations, boosters, and masks are working. It's a sign to press on, to persevere, to keep going, so we will do that. Yesterday, we announced that more than 24 additional nurses, paramedics, and specialists were being deployed to Ingalls Memorial Hospital in Harvey, provided through the Federal Emergency Management Agency. That's on top of the previously announced federal deployment of healthcare staff to Rockford's Javon Bay Hospital. And of course, we have 1,870 surge staff and strike teams working now across Illinois, with hundreds more on the way. We are still very much in a period of immense strain for our healthcare systems. So we must do all that we can to keep our healthcare workers and institutions operating and available to all who may need medical assistance. You can help too. As I mentioned, the vast majority of Illinois COVID-19 hospitalizations are occurring among the unvaccinated. The most important thing that you can do right now is to wear a mask indoors when you're with others, to get vaccinated, and to get boosted. Some people who have heard this message before think that unvaccinated people have already made up their minds not to get vaccinated, so trying to convince them just won't work. Well, that's just not true. In the first 2 weeks of 2022, 14,000 new people have gotten their first vaccine dose every single day in Illinois. That's around 100,000 newly vaccinated people, about the population of Peoria, every week. People are still listening, and many who have remained on the fence for a while now are choosing now to get protected and to protect their children. So if you know someone who hasn't yet been vaccinated, approach them with compassion, with facts, and most of all, with your own reasons for getting vaccinated. You just might be the person that helps them decide that they should get protected. Thank you, and now I want to turn it over to our Director of the Department of Public Health, Dr. Ezike. Doctor.
Good afternoon, everyone. Please don't be mad. I just want to wish sincerest birthday wishes to an incredible boss and leader, Governor Pritzker. Happy birthday. As the governor said, I am cautiously optimistic in reporting the decreasing trends in the number of cases, in the number of emergency department visits, as well as the number of hospitals. Everything is relative. While overall hospitalizations are increasing, both in the number of people that are going into the hospital with COVID every day, as well as the total number of people in the hospital with COVID, they are decreasing, but those numbers are still high. The numbers of people in the hospital with COVID are still higher now than they have been in any other surge or any other part of the pandemic. But the good news is that the trend is downward. The sheer volume, however, still is a problem. It's still a challenge to those workers, and we still have to pull every single lever available to help increase just the staff to care for those people in the hospitals. And yes, we have seen over the last month that the number of children in pediatric ICUs with COVID has increased. But at this time, there is not a COVID vaccine for our youngest ones, those 4 and under. But let's focus on what we do have, and that is that we have a vaccine for everyone 5 years and older, and that by being vaccinated, if you are in that eligible population, you can build that hedge of protection around those who are too young to be vaccinated for themselves. And the Illinois data shows that being vaccinated or only partially vaccinated as opposed to being boosted places you at 11 times greater risk of hospitalization and 13 times greater risk of dying. So you want to be on the side of the boosted. And as you also hopefully can tell, vaccination is not just about the individual who gets vaccinated. Yes, for sure, your risk of suffering severe illness and hospitalization does decrease dramatically when you're vaccinated and boosted. But being vaccinated and boosted also helps to protect others, like those 4 and under that we just talked about who can't be vaccinated at this time. Another way that we can protect others is to slow the transmission of this virus. And that's by knowing when you're actually infected. And so that might involve testing. A positive test will let you know that, yes, I need to stand down, I need to isolate so that I don't spread this virus to others. And then you can reach out to other people who maybe you were in close contact with before you knew that you were positive, so that they can quarantine, so that they can know when it's time for themselves to test. The U.S. Department of Health and Human Services is offering 4 free at-home COVID-19 tests to each household. All you have to do is go to covidtests.gov and fill out your address. HHS expects orders to ship out by the end of the month, and then they'll be delivered by the U.S. Postal Service. You are encouraged to order those tests so that you can have them when you actually need them. Again, we all need to vaccinate, boost, mask, test, and that will all be helpful as we get towards the end of this pandemic.